everyone's questions gets answered. So we will also be developing a Q&A document that addresses all the questions asked, and we'll make sure to disseminate that as well as the slides. I'm so sorry, Rachel. I think I'm getting some feedback. Okay, there we go. Okay, I think we're good now. Sorry about that. My next comment, believe it or not, was this is our first virtual event of this size and caliber, and we already preempted ourselves in that we may have some technical challenges. We're coming at you, many of us from our homes. So just be patient with us today as we work through some of those kinks and make sure that you get the information that you need. So with that, I'm going to pass it off first to our board chair, Mel Donatelli. Mel's been a critical leader throughout our efforts across the past 2 years, and she's going to start off by providing some context for why the Alliance, as builders and sustainers of school-based health here in Missouri, has rooted our work in health and racial equity. So Mel, I'll turn it over to you.
Great, thank you, Molly, and thank you everyone for being here. I'd like to just start this important celebration and information sharing session with a few thank yous. Thank you to our core team who has really made this happen. Not only do you do all of the day-to-day work to keep the Alliance running, but you also have successfully done incredible work on the census data that we will share and expanding our reach through Missouri and really just supporting everything that the Alliance does. So thank you for that. And also just to share what a privilege it is to serve on a board of directors with just an amazing group of leaders, all who share a passion for our kids and youth in Missouri. So it is truly a privilege to serve with the group we have pulled together on our board. Next slide, please. We have a special welcome today also for some of our legislators and our funders. So thank you to Senator Blunt's office for joining us today. That's really, we're privileged to have you with us and excited to have you hear the important work of the Alliance and look to partner with you even more in the future to see about how we can move things forward at scale for our kids in Missouri. Our funders, we have Express Scripts with us, Missouri Foundation for Health, Dana Brown Foundation, and the Intercode Charitable Trust with us as well. So we could not do this work without obviously being funded. So thank you all for all you've done to get the Alliance off the ground and to assure that this important work can continue. So thank you for that. So with that, I'm going to jump and start us off this afternoon with one of my favorite slides in terms of really just capturing the essence of why we do what we do. So you can read the little boy is asking if someone can help him with his baggage because he's late for math class. And so really how much do we think he's able to be successful in that class when he has the burden of sickness, homelessness, hunger, and could be a whole host of other issues impacting that child's ability to learn and thrive. Next slide, please. So we've all known for a long time good health and education impact each other in positive and negative ways. I mean, the impact is significant, right? So students struggling with things like hunger, mental health issues, sickness are more likely to be absent from class. When you're absent from class, you're less likely to continue with your education. And we know that the shorter you cut your education, the worse off your health outcomes will be throughout the course of your life. So it's definitely something that follows you along. So good health and education contribute to providing an opportunity for equity. Such drivers as family and income are certainly factors that impact that as well, but really leveling the playing field for all of our children and youth in Missouri will require good health, good education, and we have quite a ways to go in terms of equity. So where quality school-based health programs advance equity because they overcome many of the issues that our children are struggling with. So access to healthcare is not easy for a lot of our kids and youth in Missouri. It's challenging because there are transportation challenges. It's challenging for parents to get off work, and numerous other barriers that can stand in the way of our children getting the healthcare that they need, whether that's mental health, physical health, dental health, all of these things that can be a barrier to learning are in their way. Quality school-based health programs start to remove those barriers. So they've already figured out how to get to school, right? We have bus systems. The care is there. The parents don't have to get off work. We can sign consent forms and provide the care for those children. They improve access just in general. And as we talked about before, like good health leads to higher levels of education and a brighter future, as does education lead to positive health outcomes over the course of a person's life. So starting in just to give a little bit of history of how we ended up here, in 2014, several groups across our state were starting to have conversations about this relationship and this close coupling of health and education. Those were things that, healthcare providers and educators were coming to the same conclusion that while we might want to neatly put those things in a box, that's not really how people live. Those things are very, very intertwined, and they were also noticing that certain things are in the way for some of our children more than others. So again, but getting back to that equity, not everybody had the chance to come to school and be in a good place and supported and having good health and being able to stay in school and being able to learn. So there were definitely barriers for some of our children more than others. So with that, one of the school-based health programs, a type of that is a school-based health center. And so out of the work of the For the Sake of All report, so Dr. Jason Purnell out of Washington University here in St. Louis and his Health Equity Works team published a report that went over some of the challenges of the region and called to action us to think about, school-based health centers as a way to bridge some of the equity gaps that he had very clearly identified and published in his report. So around this same time, we had the Missouri School Board Association. Their members were contacting them, starting to, ask, how can we support our children? Because there's this just unprecedented need to be able to address health because of the impact on education. And as we know, as that goes forward, education on health. So they too convened stakeholders across the state to start thinking about, what might a school-based health program look like for our schools. Around this time, the Citizen Commission report was published calling and recommending for school-based health centers. We had the Community Services Preventative Task Force also calling for school-based health centers as an intervention to improve equity. So all of these various drivers across our state, we came together in early 2018 to form an affiliate of the National School-Based Health Alliance at our Missouri, the state level. So the Show Me School-Based Health Alliance was really born there in 2018. Next slide, please. So as the Alliance was founded, we determined that it was really going to be our mission to support communities in building and sustaining quality school-based health programs with this overarching vision that every child and youth in our state of Missouri has an equal opportunity to succeed by assuring access to high quality care. So the Alliance was incorporated in 2018. Our board was established at that time, and it's really an honor to celebrate our 2-year anniversary with all of you on the phone, because you are here and you are on this call because you have likely played a role or will play a role in the future in helping us to achieve this vision for our children in Missouri. Next slide. So while a lot of good things have happened between 2014, 2018, and where we are today, and we humbly acknowledge there's still a ton of work to do, The COVID-19 pandemic has really just highlighted the severe inequities across our region. Our urban and rural communities are suffering. We've had subsequent, civil unrest at the killing of George Floyd, Breonna Taylor, Ahmaud Arbery, and many, many others. I mean, there's so much to continue to address, and both the racial injustice and just the general racism and inequity in our world. So I will, I'll end my introduction and the slides as walking through our values, because I think that's really important, because it grounds us in everything that we do. So as an alliance, we value to be student-centered, to create programs that are outcomes-driven and that are sustainable. We really want our children, our youth, our educators to be able to count on these programs. We don't want to establish a school-based health program and the families and everyone could count on it for a year, but then it's gone the next year because we don't have sustainable funding. So we are really, really wanting these to be sustainable. So we view inclusiveness, collaboration. We know that access for all our Missouri children leads to health and racial equity. And the value and the power of innovation to help us achieve that is something that the Alliance is very supportive of. This is all driving us towards equity. And really, we want that to be the lens and the backdrop that is in the back of your mind as we're going through the accomplishments for the last 2 years, and we're highlighting the work to come, is to really strive towards more equity for our children in the state of Missouri, and really giving everyone the opportunity to succeed in our state. So with that, I will turn it over to our executive director. So Molly Tickner has been with the Alliance for about 1.5 years and has done a great job leading us through our strategic planning process and helping to support the programs that exist and helping stand up additional clinics. So with that, I will turn it over to you, Molly.
Great. Thank you so much, Mel, for the wonderful introduction, and welcome everyone. We are going to start looking at the past 2 years from a high level and really looking in 3 different phases. Our first 9 months, to which Mel alluded to, we were focused on building our own capacity in an organization, including most critically recruiting our volunteer board of directors, and that are made up of school-based health program stakeholders from across the state. And then our committee members, who continue to be a guiding light to the work that we do. We couldn't do the work without them. We then brought on our evaluation coordinator, Rachel Barth, who you'll be hearing from shortly, and hired the rest of our core team while continuing to build the Alliance's infrastructure. This work could not have been possible without the generous support of our donors that Mel mentioned earlier. So thank you to them again. From July of 2019, when I first started, and then soon after when we hired our training and technical assistance manager, Molly Emming, we focused on understanding the critical needs of our community, doing frequent site visits and outreach to build our network and build out those community partnerships. And then, as Mel mentioned earlier, the past 7 months, we have really been focused on adapting to the ongoing needs and the ever-changing needs of our students and our mental and our school-based health programs. We've done this through heightened advocacy efforts, sharing resources and information, and supporting our programs and sustaining during a time of low volume, given the school closures that started in March with the COVID-19 pandemic. We now want to review the highlights of our work and our key areas of support we have provided over the last 2 years. We have conducted a needs assessment, interviewing school-based health stakeholders to learn about the challenges and threats to school-based health sustainability. The Alliance is also part of a National Quality Initiative collaborative with several other state affiliates. 4 of our school-based health centers and representatives from Missouri state agencies to really look at how we can learn from one another and effectively better support the growth and sustainability of school-based health programs. Related to training and networking, we have hosted several webinars on school-based health best practices based on the needs of our network. We have convened communities of practice with school-based health providers across program type to learn from one another and continue to build that peer-to-peer networking opportunities amongst providers and school-based health staff. Further, we've advocated for policy changes and pursued partnerships to address sustainability challenges of school-based health programs. Specifically, some of the work that we've done where we spent the first really 6 months to a year, and it continues to go on. We partnered with several coalitions and like-minded organizations to bring awareness on the significant drop in youth and the families' enrollment in Medicaid. We worked together with our partners to create key messaging around how school-based health programs could support and create materials to share with families on how they can ensure they are covered and problem solve to gain coverage. We also met with our federal policymakers, educating them on the impact of school-based health and how they can be an advocate and a support to our families, advocating for consistent school-based health funding, particularly around the CARES Act funding that came down to our schools and our states so that school-based health providers can assist during the COVID-19 pandemic. Through the support of one of our donors who is present, Cigna Express Scripts, we were able to provide funding to school-based health programs directly that were either planning or implementing their programs. We have also fostered our existing and continue to build our new partnerships to support the implementation and sustainability of school-based health. So we're excited to see so many partners at the table today. In spring of 2020, the Alliance support and advocacy efforts shifted due to the COVID-19 pandemic. And we heard from our network the need to learn from one another and work together to meet the overwhelming needs of our communities, schools, and families. We offered several virtual listening and learning sessions focusing on topics that were relevant to our communities. With the support of our board, our stakeholders and committees, we developed a guidance document for school-based health programs for school reopening and how they can support during the pandemic. We also contributed to the development of the Missouri School Boards Association Pandemic Recovery Document and participated in several national webinars and panels to share how Missouri school-based health programs were supporting their communities and schools. But we're not done yet. We have a lot of work to do. We want to leave you with a sneak peek at our 2021 key priorities that our co-chair Janelle Porter will focus on more in depth later, but so that you can see that they're an expansion upon the support we've been providing over the past 2 years in terms of continuing data analysis, providing training and technical assistance, and continuing to build partnerships and advocate for school-based health. In addition to sharing how we've helped to build and sustain quality school-based health programs, it wouldn't be a school-based health program showcase without highlighting a few of our programs. I'm now going to pass it over to Molly Emming, the Alliance's Training and Technical Assistance Manager, who is going to highlight some of the work of some of the great work of our school-based health programs.
Thank you, Molly. As the Training and Technical Assistance Manager, it has been my pleasure over the past 2 years to meet so many of our school-based health program providers, to see their physical locations and to hear about their day-to-day impact that they're having on Missouri students. So today, in an attempt to highlight and capture some of that incredible work, and also just to share some good news during this stressful and unprecedented time, a few weeks back, we put out a call for school-based health success stories. And we were thrilled to receive several that demonstrate how school-based health programs impact students and schools in different ways, from helping a single student to improving the health of students and families more generally, and then finally to highlighting the overarching impact that school-based health programs have on their school communities. I'm going to briefly highlight these 3 programs and expand upon the success stories that they shared. I also had the opportunity to catch up with a few of them, virtually, of course, and I have some video clips to share with you all so that you can hear directly from them about the incredible work that they're doing. Our first program is a school-based telehealth program located in the Odessa School District and sponsored by the Healthcare Collaborative of Rural Missouri and Live Well Community Health Centers. The program, which started in 2017, consists of a community health worker who serves as both the telepresenter, helping students and staff connect to care, as well as a traditional community health worker in that role, assisting students and families in applying for Medicaid, food stamps, and unemployment assistance and other supports. Primary care services are available at the Odessa Telehealth Clinic to students and staff. The success story we wanted to share and highlight today is from last school year, and it demonstrates how the community health worker at Odessa responded to an individual student's needs. A student had cut their hand open with a knife, and they needed a tetanus shot. So while shots are outside of the typical scope of work provided via a telehealth program, since the student was consented to receive services and they faced other barriers to receiving the tetanus shot elsewhere, the community health worker was able to collaborate with LiveWell's medical director to actually come to the school to provide the student with this shot that they needed. This single story really, for me, reflects the dedication that I see our school-based health program staff show and demonstrate in their work every day. I did get the opportunity to speak with Mafalda Cannon. She is the community health worker at Odessa. And here's my first clip, and this is a short one of her describing the event itself in more detail.
He had sliced his hand open using a knife to get a knife open. And then when it slipped, it just lanced his hand open. She called the parents asking if he had had a tetanus shot, which he had not. And so they said, will you take him to get a tetanus shot? And even though they said yes, the school nurse knows a little history about this person, and so she would seek him out each day and change the bandage and then ask him if he had his tetanus shot, and he had not. So then she proceeds to call, I believe she just called here to see if we could find out if I gave tetanus shots, which I do not. I am not a nurse, you know, I'm really just the mouthpiece and the hands for telehealth. And so what happened is we brought him over here to the clinic, and he waited for our medical director to come by.
So Mafalda goes on to explain how they worked with the medical director to get the tetanus shot to the school and get the student what they needed. I want to expand, though, on Mafalda's comment that she's just the mouthpiece and hands for telehealth, which is truly an understatement for the work that she puts in to support families in Odessa. So here's her response to when I asked her to tell me more about what she does for families every day.
Resources for, well, every now and then I will get a family that the children, maybe they've just moved here from another state possibly, and we can get them on Medicaid if the family income is as such. There's provisions that we have at our warehouse, the personal items. Maybe they're on food stamps, and if they're not, then we can get them on food stamps, hopefully. But the things that they sometimes struggle with is like laundry soap, shampoo, cream rinse, toothpaste, toothbrushes. We have all that in our warehouses. And so we can give them, we call them goodie bags. And if they have more of a need in one area than the other, then maybe they get 2 or 3 of those things, you know, to help them out. But just like we just had a membership meeting at noon. And so there's a lot of members on there that provide services that maybe HCC doesn't supply, but we've got all those resources that we can fall back on and call them and say, what can you do? For instance, if they're behind on their utility bill, that's not something that UCC can help. I mean, HCC can help with, but there is a company that gets these, I call them pockets of money. That's how I refer to the people, the families that come in. They have funds that they can provide and help you get caught up on your utilities or whatever.
So in addition to highlighting the benefits of having a community health worker to support families, Mafalda also touched on two really unique other supports that HCC and Live Well Community Health provide to the Odessa community. One is the warehouse of donated items, which they pass along to families to help to meet their social needs. And the other, which she was alluding to with the membership meeting, is their network of partner social service agencies, which meet frequently to share and coordinate resources, all to the benefit of meeting families' needs. At the very end, as we were wrapping up, and the last clip that I'll share with you from Mafalda, she talked about the benefits of telehealth programs for students and staff generally, beyond just being able to provide
Based on their income, and then they can afford to come and get taken care of. If you have something, for instance, respiratory or whatever, that may not get better if you don't get it taken care of. And then you're going to cost even more money because you may have to go into the hospital. You know, but if you can get it addressed quickly and get it taken care of, they'll just be happier, they'll be healthier, and they'll be happy because they are healthy. But if we can take any of that stress off for them with the things that we can provide, it's just the icing on the cake.
I think Mafalda ended it really well there in that she summarized how school-based health programs can impact individuals in really this singular story of a student who was able to get their tetanus shot. The next program I'll highlight is the University Academy Wellness Center, which is sponsored by Children's Mercy Hospital and located in Kansas City. The University Academy Wellness Center is a school-based health center that was started in 2005. The Wellness Center serves students in grades K through 12 and offers services at no cost to students. They address acute illnesses and injuries, asthma and allergies, and school and family issues, as well as provide health promotion, immunizations, and sports physicals. Here you can see a recent picture of staff from the Wellness Center. While 15 years of service to University Academy students is celebration enough, today we wanted to highlight their recent Chew the Flu drive-thrus. And this singular success story really helps to demonstrate how school-based health programs respond and to address student health and meet the ongoing and emergent needs of their families. Over the past few months, Wellness Center staff have hosted drive-through flu shot clinics to assure students could still receive the flu vaccine, even though the school is closed and students aren't able to come into the center. They also felt it critical to provide flu vaccines this season to prevent any types of symptoms that could be confused with COVID and to help keep students healthy during this time. Here you can see one of the providers actually administering a vaccine to a student in their car. Wellness Center staff vaccinated over 40 students during the first two-day event. Then after hosting an additional two-day event following this initial success, they are now up to close to 100 flu vaccines administered overall. This is a significant increase from the approximately 60 flu vaccines that the center had provided at this time last year. And here's just another picture from their event. You can see the cars waiting patiently for their vaccines. I had the opportunity to speak with Amanda Stiers. She's an advanced practice nurse practitioner who is one of the two providers at the center. So I first asked Amanda just to explain how they operationalized providing flu vaccines in vehicles.
Just went up to the car, rolled the windows down. The children were either in the front or in the back. And we just approached the car and we had the kids interact with us, having them hold the Band-Aid. And we just did our flu shots in the car. What was interesting was that the kids handled the flu shot so much better this year. I mean, even the little ones, because they were with the parent or guardian, they were in the back seat, the adults were in the front seat.
After hearing how the students' experience had improved with the drive-through events, I then asked Amanda what parents think of the events. And her answer really expanded upon so many of the barriers that school-based healthcare overcomes for parents and families in general.
The parents are loving it because our hours are flexible. They don't have to go to their primary care provider or take their children out, which right now many parents are not wanting to have their kids out in public or crowded spaces or wait in line in a waiting room or anything like that. So they do not have to get out of their car, and they are much safer that way. So parents have been welcoming to this flu shot drive idea.
By providing care to students in the location where they spend the majority of their time already, which is school, of course, school-based health programs overcome so many barriers, such as limited appointment availability during non-working hours, transportation to the provider's office, and missed class time. Finally, toward the end of our conversation, I asked Amanda to tell me about how the Wellness Center came to be from its beginning and what benefits she sees provided to her students. Her emphasis on the connection between health and education, I think will really hit home given what Mel and Molly as well have really reiterated in the connection between good health and education.
We're creating this beautiful charter school. We also need to keep the families and children healthy as well. So not only education, give them a good education, but also keep them healthy. And we know that when children are ill and out of their seats, out of school, they don't do as well. So we supplement children's healthcare and management with a collaborating physician, primary care physician in the community, to keep our children in their seats and learning, and with very few school days missed as possible. So
hearing all of those benefits and the connection between health and education, just to bring it back to the Shoo the Flu drive-through events that they've been hosting, we celebrate the work that Children's Mercy has done to continue to serve students during this time. The final program I'll highlight is located in North St. Louis County. In response to poor health and mental health outcomes facing youth and young adults in the St. Louis region, the spot at Jennings High School was established under the Division of Adolescent Medicine at Washington University School of Medicine back in 2015. The spot stands for Supporting Positive Opportunities with Teens, and their major funders are the St. Louis County Children's Services Fund and St. Louis Children's Hospital Foundation. They provide acute and preventative health, mental behavioral health, screening, assessment, and counseling, as well as clinical case management and other support services, all of which are available to students at no cost. Today, for their success story, we're thrilled to celebrate the spot's 6th school year of serving students at Jennings High School. In 2019, they reported that 78% of students at Jennings High School have a parental consent on file and are thus able to receive services from the center. This is above the National School-Based Health Alliance's recommendation of the percentage of students that should have a parental consent on file. Further, among those students with consents on file, 70% of them were able to access some sort of service from the spot. So in addition to demonstrating an increase in access to care to students, the school staff and administrators from Jennings also recognize the significant barriers to students, with one of the school administrators explaining the spot is helping to create a safe place for students who do not have one outside of school. While I wasn't able to catch up with the spot staff in time to record an interview, they shared a video. This was created by the St. Louis American a few years ago. That's a newspaper here in the St. Louis area. And they asked me to share this one with you all instead.
There's a lot of kids here who has been through a lot of things through their life. Me as being one of them. I came here and I talked to Miss Shea, Mr. Dowden, and Miss Rochelle, and they actually understood exactly like what I was going through. They did not judge. So like a lot of kids come here to like get the expression off their chest that they need. So they actually help kids get through painful things through their life.
The Spot at Jennings is a comprehensive school-based health center, so we are a fully functioning medical clinic embedded in a school. We provide medical services, including access to reproductive health care. We have a full-time mental health professional. We have a case manager. As part of our services, all kids who come to the clinic are screened for depression, for substance use, for access to dental care, and we do a 2-question brief screen for symptoms of trauma. In the screenings that we've done so far, we have had a little over the national rates for depression screen positive and for substance use positive.
What the Spot Clinic has done for us is this. It has taken away the excuses and some of the barriers that stop our children from coming to school. It has enabled students to come to school and to learn and produce, and that production is seen in our academic achievement and our data. Last year we had 100% graduation. I don't think that could have happened without the Spot Clinic.
This video really highlights the benefits and impact that the Spot has specifically in the Jennings School community, but it also summarizes really well the benefits and impact that I hear about every day from our programs across Missouri. I have learned so much from all of our school-based health programs, which really demonstrates the importance of one of our key strategies for building and sustaining school-based health programs, and that's fostering peer-to-peer networking. So today I am thrilled to also share with you all a new tool for our community of school-based health stakeholders to connect them with each other and learn from one another. And this is a directory of school-based health programs in Missouri, which includes, you can see here across the top in red, those are the field headers. It includes information about the sponsoring organization, their contact information, so that you can reach out and email them, the school district and area that they're located in. This directory, which will now be housed on our website, will allow you to sort any of the fields alphabetically. That's the little toggle there at the top. It'll also allow you to filter by fields, such as whether they provide telehealth or not, their sponsorship type, their school-based health program type. You can filter by all those things. And then you can also search. And our recommendation here would be to search by things like school district. And it will query a list of programs and contacts to match your interests. The directory is a point in time picture of programs that we knew about and had contacts to prior to it going live, which it will today. So it's certainly not an exhaustive list. The page that it's housed on includes directions for adding or updating programs. And we will include the link to visit the directory in our follow-up email to you all so that you have this as a new tool to leverage in connecting with providers across the state. Before I hand it off to our next presenter, just a quick reminder, if you haven't already done so, please enter your name and organization into the chat. We're going to continue to do our best to answer questions either in the chat or verbally if we can catch them. We're hopeful we'll have a couple of minutes for Q&A at the end as well. But a reminder that we will disseminate a Q&A document that has all the answers to today's questions. And then finally, for those that may have joined us late, we are recording today's call And the slides, the report briefs, the other resources that we'll get to today will all be shared via email and posted on our website by the end of the week. And with that, I am thrilled to introduce next my colleague, Rachel Barth, who is the Alliance's Evaluation Coordinator. Rachel will deliver our much anticipated report out from our first comprehensive census of school-based health programs here in Missouri.
Thanks, Molly. As many of you are likely aware, the Alliance launched our first comprehensive census of school-based health programs in Missouri last September of 2019. Our findings are intended to provide a point-in-time snapshot of the school-based health landscape in Missouri. This census aligns with the triannual census conducted by the National School-Based Health Alliance, but greatly expands on the types of programs represented, as the national census only includes programs that provide primary care services with acute care. The findings of our census will be shared as a series of report briefs. The first 2 briefs will be disseminated by the end of the week, along with the materials from this presentation. Today, I will share some of the highlights describing these programs and who has access to them. School-based health programs are a shared commitment between a community's schools and healthcare organizations to support students' health, well-being, and academic success by providing preventative, early intervention, and/or treatment services where students are in school. With the Alliance's expanded definition of school-based health, 6 types of programs have been identified thus far. School-based health centers, the most well-known program type, provide primary health care at a minimum at a fixed site on a school campus. It's like a doctor's office at school. School-linked healthcare programs provide healthcare services at an off-campus fixed site near the school, such as at a hospital. These programs can include transportation for students from school to the health center or priority appointments for those students. School-based mental health programs, as the name implies, provide mental and behavioral health services at a fixed site at the school campus. Similarly, school-based oral health programs provide oral health services at a fixed site on the school campus. They have dental operatories permanently located in a room at the school. Telehealth programs can offer a variety of type of services, but are unique in that they provide 100% of their services using telemedicine technology. The telemedicine equipment, along with a telepresenter who operates the equipment, are located at the school while the healthcare provider is elsewhere. Lastly, mobile healthcare programs do not have a fixed site and rotate their healthcare teams throughout multiple schools, generally using a van, bus, or clinic on wheels that parks on or near a school campus. Over the next 30 minutes or so, we will explore what programs exist, what services are offered, who has access to them, and where programs are being planned. Let's start by looking at what programs currently exist. Our data collection efforts confirmed 675 school-based health programs across the state. More than 3/4 of these programs are school-based mental health programs. The programs are sponsored by 47 organizations across 6 different organization types. More than 1/3 of the sponsoring organizations are federally qualified health centers or lookalikes. Sponsor organizations provide the backbone support to school-based health programs. Usually, these organizations employ the healthcare providers and often provide financial support for the programs. To get a better understanding of what school-based health looks like in Missouri, let's look at the types of services that these programs offer. School-based health programs provide a variety of services that we have divided into 2 categories: healthcare services and supplemental or support services. Healthcare services include mental or behavioral health, primary care, vision care, oral health, and physical health. Although you can likely figure out what most of these services are, I want to point out the difference between primary care and physical health. There is overlap in these 2 types of healthcare services, where both can include services such as well child visits or sports physicals. The difference, though, is that primary care must include acute care, such as treating minor illnesses, whereas physical health services do not. As you can see from the graphic, 85% of our Missouri programs offer mental and behavioral health services, and more than 1/3 offer primary care services. The remaining services are each offered by less than 10% of programs. Supplemental or support services are often offered in conjunction with healthcare services and include services such as nutrition, health education, parent supports, and others. 86% of our programs offer at least one supplemental or support service in conjunction with their healthcare services to meet the needs of their students, even though these services are generally not reimbursable. School staff training and support is the most common supplemental service provided, offered by 83% of programs. Nutrition services, on the other hand, are the least common service, only offered by 1% of programs. Now let's turn our attention to who has access to these programs and services. Over 520,000 students attending public or charter schools in Missouri have access to at least one school-based health service, representing 57% of students. Let's let that number sink in for just a minute and take the opportunity to thank our school-based health providers that are reducing barriers to access to care and improving the health and educational outcomes for these children and youth. Thank you. However, that still leaves nearly 400,000 students without access to this evidence-based strategy. In addition to increasing access to care for students, school-based health programs can increase access for other populations as well. More than 3/4 of programs in Missouri are accessible to non-student populations, including school faculty and staff, student family members, the general community, and others such as faculty and staff dependents. School faculty and staff are the most common non-student population with access to programs. Their access to school-based health programs can reduce the number of teacher absences and classroom interruptions, thus leading to better educational outcomes for our students. As we saw earlier, more than half of students have access to any school-based health service, but there are substantial gaps when looking at access to each type of healthcare service. We can see that 1 in 3 students has access to mental behavioral health or oral health care, but primary care, physical health, and vision care services are available for far fewer students. It's important to keep in mind that these students may have access to these services elsewhere in their communities. We want to acknowledge our programs and celebrate their successes in increasing access to care. And at the same time, it is crucial to examine where our gaps still exist. Taking a closer look at mental behavioral health services and which students have access, we can see an underrepresentation of African-American students. Only 1 in 5 African-American students has access to school-based mental behavioral health services, whereas 1 in 3 white and other minority students have access to the same services. Nationally, most children and youth who are receiving mental health care access their services at school. Given that we also know that racial disparities in mental health care access persist, we have a critical opportunity to expand access to mental behavioral health services for African-American youth in Missouri. Additionally, of the students who have access to oral, physical, and vision health care, over 90% of these students can only access these services through mobile programs. Mobile programs are periodically available at school and cannot be relied on for ongoing sources of care. Next, we'll look at students who qualify for free and reduced lunch. Students who qualify for free and reduced lunch are more likely to face significant barriers to accessing healthcare, such as a lack of providers in their community, no transportation to get to a provider, and parents who are unable to take off from work, all of which can be addressed by the school-based health program model by providing care in schools where students are already located. Nearly half of the Missouri student population is eligible for free and reduced lunch, and about 2/3 of those students have access to school-based health programs. 1 in 3 students eligible for free and reduced lunch in Missouri has access to oral or mental behavioral health care. However, only 1 in 6 has access to school-based primary care services. This data provides evidence of an opportunity to improve healthcare access for our youth and our children. Now we'll turn our attention to the school level. School-based health programs are accessible to 1,234 schools across Missouri. Of the total number of schools with access, 1,212 are public or charter schools, making up half of all of our public and charter schools in the state. An additional 22 private schools have access to these same services. We do not have data on the total number of private schools in the state, thus the proportion this constitutes cannot be determined. Looking specifically at public and charter schools, each school was assigned a school type based on the lowest and highest grades served in the school. Nearly half of schools in Missouri serve more than one type of grade level, such as kindergarten through 8th grade, and therefore are assigned more than one school type. More than half of early education and elementary schools have access to school-based health, and fewer middle and high schools have access. This follows the national trend reported by the National School-Based Health Alliance that school-based health centers in particular are more likely to serve elementary schools than other types of schools. Shifting to a geographic lens, we can look at access by county. There are school-based health programs located within 79 of Missouri's 115 counties, making it more than 2/3 of the state. Mobile and school-based mental health programs have the largest reach, touching 47% and 41% of counties respectively. About 2/3 of programs are in rural counties and about 1/3 are in urban counties, which is close to the distribution of rural and urban counties in the state and indicates that there are programs across a variety of community types. Although there are school-based health programs in the majority of counties, there are visible gaps in the northwestern, southwestern, and southeastern regions of the state, where there are clusters of counties without any school-based health programs. 86% of these counties are classified as rural. While the unique health needs of these communities may not warrant a school-based health program in every county, given the known access challenges in rural areas, additional assessments are needed to understand what healthcare providers serve these communities, what gaps in access to care may exist, and if local stakeholders can leverage the school-based health program model to partner to address those gaps. In addition to learning about what school-based health programs exist, we also asked schools and healthcare providers if any new programs were being planned. At the time of the data collection, respondents reported that programs were being planned for 39 school districts across 28 counties, plus an additional 2 districts that had not yet been determined. More than a quarter of these districts do not currently have any school-based health programs. This map displays the counties where school-based health programs currently exist, indicated with the blue shading as we saw before, and shows where the planning programs will be located, as indicated with the yellow outlines. These new programs will fill in some of the gaps we looked at earlier, particularly in the Northwest, but significant gaps continue. More than half of these programs being planned are intending to offer mental and behavioral health and primary care physical health services. Hopefully, you now have a better understanding of what school-based health programs exist in Missouri, what services they offer, who can access them, and where new ones are being planned. As I said in the beginning, the first 2 report briefs will be shared electronically before the end of the week. Please share these with your networks. We know that all programs that exist in our state are not represented in our data. We also know that this data is constantly changing, especially now more than ever, as programs are opening, closing, and adapting to the changing needs. We will continue to regularly collect data on school-based health programs and do our best to keep up with the changes. Please participate in future data collection efforts so that your program is represented and we can develop a more complete picture of school-based health in Missouri. We also know that these reports do not mark the end of our work. They are only the beginning. As Mel explained earlier, equity is one of our core values. Now that we have a better understanding of the school-based health landscape, we can take the next step in pursuit of equity by taking a closer look at who does not have access and where these programs are needed most. Now, I'm happy to turn it over to Janelle Porter, the Alliance's co-chair, to discuss how we're moving forward to continue to build and sustain school-based health programs.
Thank you, Rachel. So now that we've listened to the information today, you might be starting to think, well, where do I go from here? How can I help? Where do I get started? How do I make a difference in ensuring that school-based health is actively available in my community? So we're going to talk a little bit about that. And first, it's important to look at what the mission is and really where we want to put our focus. So given that our mission is to build and sustain school-based health programs, before we talk about that call to action, I want to shed some light on the barriers to startup for these programs and their sustainability. These are really key for us to understand and address moving forward. And we've learned more than anything that we cannot do this work alone. Our school districts and healthcare providers seeking to implement school-based health programs lack funding for equipment and capital improvements, and they face inconsistent reimbursement rates and a lack of reimbursement for wraparound services to sustain their programs. And now they've been presented with new challenges, such as securing funding for telehealth equipment so they can safely continue to see students throughout the COVID-19 pandemic. So as we approach 2021, based on feedback from our network, and we mentioned this before, the work of the school-based health census and our accomplishments over the last 2 years, as well as understanding the barriers we've faced, we've identified those key areas of focus for us. And to Rachel's point, we want to continue to leverage the data that was collected through our first census to understand where these gaps are in accessing care. We will also continue to provide technical assistance and training to support our school districts and school-based health providers, especially as the landscape just continues to change with COVID. We want to expand our relationships with local policymakers because we know that we really need to change systems in order to better support our school-based health programs. And finally, we will increase our community partnerships to enhance collective action toward building and sustaining quality school-based health programs. So in order for the Alliance to accomplish our goals and to address the key priorities and the emergent needs within the healthcare and education systems, this is where your support is needed. As healthcare providers, educational leaders, and school-based health stakeholders, you are really the experts in your community. So we ask that you reach out to your healthcare and educational systems, local policymakers, and health departments to form regional coalitions and build relationships, as well as discuss the respective services and needs of your school communities. Also, we want you to learn about the potential funding opportunities specific to your region, local philanthropic organizations, county resources, and others that might be able to help support bringing or even expanding school-based health programs to your area based on those needs. Engage your commissioners to learn more about potential CARES Act funding that's been provided to multiple counties and how that funding can support the healthcare needs of your communities and specifically schools. Form a regional network of school-based health stakeholders to include families as well, because they can be part of this process too. And then finally, while the Alliance can support you in all of these actions, we really want to highlight our commitment to equitable access to quality healthcare for Missouri youth, families, and communities. So please reach out to us. We're here to support you in building and sustaining quality school-based health programs and just to help you figure out where to get started. So please use us and the resources that we have for that. I'm going to turn it back over now, I think, to Molly. Is that right?
Thanks, Janelle. We just wanted to reiterate this on a slide. I know that Mel said it, Molly said it, but we wouldn't be able to do the work that we do and support the work of our programs as we have been able to without the financial and in-kind contributions from those who support us. On this last slide here, I've included our contact information for how to reach us. To reiterate Janelle's point, we are here. We're here to answer your questions, big and small. And our website is linked there as well. We have a host of resources available there. That's where we post our upcoming trainings and technical assistance, and where you can sign up for our newsletter if you don't already receive it. So with that, I'll open it up. We'll open it up to questions since we do have a little bit of extra time. So you're welcome to either unmute yourselves. You can do so using the unmute button down in the lower left-hand corner of your Zoom screen, or you're welcome just to continue to type into the chat what questions you might have. Hearing none. Sometimes silence is reflective of digestion. So we will hang on for several more minutes if you want to hang on with us and those questions do come up for you. I did see one question pop into the chat. I'll pose it, and then from our panel of speakers, we can decide who wants to answer it. How does Missouri compare to other states as far as school-based health center coverage? Maybe Molly or Rachel, if you wanted to take that one.
Sure, I'll take that. And then Rachel, if you want to chime in with any data-driven questions. So we do know that the Missouri is a little bit unique in the way that we reclassified our definitions of school-based health programs because we expanded upon the national's definition from 4 program types to 6. So the 675 programs plus that Rachel indicated actually are a little bit larger than some of our other national alliances and state school-based health because the classification for them is school-based health centers, which is that holistic physical health plus acute chronic care and one other type of service. So if you look at the data, we've seen like we have a lot more programs, but just because we classify them in a different way, it makes it a little bit difficult to do apples to apples comparison.
I'll just follow that up with we could do a comparison with our data, and part of our intent is with the data we've collected to be able to better represent our state in the national census, which has been put on hold due to COVID and everybody else's world's changing right now. But we have not done that comparison ourselves to see how we compare. And I'm assuming your question is related to number of people we're reaching and who's got access. So we have not done that ourselves, but I anticipate with the next census that comes out from the National Alliance, you would be able to see some of that information come through.
Great question. Thanks, Meg. I'm just scrolling back through to make sure I didn't miss any questions. How have your efforts been received in Jeff City? Maybe Mel or Janelle or Molly, if you want to talk about, I'm assuming the root of that question is with our legislators here in Missouri.
Yeah, actually, if Brian Schmidt is still on. Brian, are you still here? Do we see him? Brian is the chair of our Policy and Advocacy Committee and does a lot of really great work with our legislature to inform on the priorities and the gaps in care that our kids that we're seeing across the state of Missouri in terms of our kids. So we've moved forward some things like homeless children being able to sign consent for treatment. That was one of our big initiatives over the course of the previous year. And then I think Molly was sharing some of the work that had been done with the Medicaid enrollment and those being kind of kicked off the list because of eligibility verification being super challenging. So there's just a couple examples of things where we have been able to work at the state level in Jeff City and have had some success. we definitely have more work to do. I would say we're not where we want to be with that in terms of state support. There are states like Colorado who have had school-based health centers for 25 years. It is a state line item. It is a line item in the state budget, and those are funded because the evidence is so strong that it's good for Missouri children and their welfare and their education. So, ideally, we at the state level would be in that place sometime soon to where we wouldn't have those gaps that we saw on the map as Rachel was walking us through those. And, something else that I think is important to remember is even those shaded areas, I mean, those are showing that there's one school-based health service is really all it took to make that little area turn dark green. And so that doesn't mean that all the children there have covered all their needs covered or all the services are covered in every single school, which is really a goal for those of us who are so committed to this work, is that there wouldn't be any child in Missouri who couldn't have access to these services, and that will require more support from a funding perspective at the state level.
Yep, and just to plug too, we also have a few legislative site visits planned coming in December and maybe in January, depending on how the holidays. So we're encouraging the local and state legislators to go to and inviting them to school-based health programs. Obviously, this year it will be virtually, to see the programs and the service they provide so they can see the true impact on the communities that they serve. So that was one of our calls to action, is also to engage with your local legislatures. And if you do have a program, we can potentially help bridge that gap to invite them to do a virtual visit, to meet some of the providers, talk to the families, talk to the students who utilize the services to see the true value. So starting to build those relationships and reaching out and having conversations and educating about school-based health. That's one of our big priorities in the past year, is educating those in Jeff City about the benefits of school-based health and the true impact. So we're going to continue that work, obviously.
Thank you all. While we wait for a couple other questions, I did want to give a shout out to our National School-Based Health Alliance staff and the team there that have joined us today. They're here congratulating us. However, we wouldn't be where we are without their support. So just a huge thank you for them joining us today, and also for the support that they've provided us in our first 2 years. I'm not seeing anything else come through the chat. So again, you're welcome to hang on. We're gonna be here for just a few more minutes, but then we'll go ahead and close it down. Just another reminder that our communication channels are open. So if a question comes up, email us, reach out to us, and look for the slides and a recording of today, and all the other resources and materials that we mentioned before the end of the week. Thank you all again so much for coming. It's great to see so many of your faces.